Let me just say, today we are officially announcing a special effort led by Health Commissioner Dr. Lena Wynn. I've always said that Baltimore needs everyone to work together to move our city forward, not only including the government, but we can tackle all of these challenges together if we work together. We have an excellent partner all across the city, from the academic institutions, am I correct, as well as a thriving tech community. Everyone is essential to finding a sustainable solution to continue to make our city safe and healthy for all of our residents. This is a very unique program, and so Dr. Wynn is here, and I want her to explain the program to you and then introduce all these wonderful people that are here with you. Okay?
Thank you very much, Madam Mayor. Thank you, Mayor Pugh, for your leadership and for your vision. And I'd also like to acknowledge our, we have two teams that are here with us today. We have our team at the Baltimore City Health Department. Mike Freed, who is our CIO, was not able to be here today, but we have Sonia Sarkar, our Chief Policy and Engagement Officer.
I'm back there.
So, Jeff Long, Lisa Parker, Thomas Clemens. You can raise your hands. So this is our team who are here for our community risk reduction. They do outreach. Then we also have our partners at Code of the Schools. So Mike and Gretchen LeGrand, who are the co-founders. And all right, there you are. And David Gatewood, who you'll be hearing from shortly. And then Kenneth Williams is here as well. Kenny Williams. So I am proud to represent the oldest health department in the country that always has set the standard for public health innovation. And we strongly believe in the power of partnerships to move the needle on health outcomes. For example, our Be More for Healthy Babies program has reduced infant mortality by nearly 40% in the last 7 years through 150 public and private partners. Mayor Pugh and I also recently gave out glasses for our Vision for Baltimore program, our 1,000th pair of glasses.
Which is a really great program, and what we did learn through that program was that a lot of our children were failing school, not because, you know, they couldn't read, they couldn't see, so they couldn't learn how to read. And I remember when we were at that school that day and just watching the smiles on the young people's faces when they got their glasses, because they moved from the back of the class to the front of the class. But go ahead.
That's right.
That program.
Absolutely, and we appreciate your support in all of these and all of our efforts. And so last year we launched another public-private collaboration, which is a first of its kind civic innovation program called Transforming Engineering for Civic Health, abbreviated Tech Health. What this program involves is that the health department identifies the most pressing public health challenges in the city. Knowing that we can't solve these problems alone, we then recruit teams of engineers and designers and coders, community members, and even students to tackle these problems and also to develop these targeted solutions in partnership with the health department. So in fall of 2016, that last fall, we identified 7 of these most pressing public health challenges, including, as you'll hear today, the opioid epidemic, but they also include modernizing our child and infant mortality follow-up process, identification of neighborhood-level asthma rates, connecting re-entering citizens to health and social services, and also increasing food access and education in our schools. So for all these 7 challenges, we approached, as the mayor said, academic institutions as well as local networks of incubators, community organizations, and others to then recruit participants who then work in multidisciplinary teams of 4 to 6 people. And then over the last 6 months, these teams have worked with our teams at the health department to develop prototype solutions, followed by design and testing. Now, in time, over the next year or so, we're going to be launching these other tools. And today, I want to acknowledge the work of Code in the Schools and to talk about our partnership to save lives from overdose. We've talked about this a lot, that overdose is killing our residents, and in particular because of fentanyl, which is a drug that's many times stronger, up to 50 to 100 times stronger than heroin. And what we're finding out, and our outreach workers are telling us this every day from their work, is that people are using fentanyl without realizing it, that unfortunately fentanyl is getting mixed in with heroin, cocaine, with prescription drugs. And so they're overdosing and dying without realizing what they're taking. So we've had a citywide fentanyl task force.
Yeah. How many people died last year?
Last year, nearly 700 people died from overdose, and it's been an increase in fentanyl overdoses of over 35 times compared to 3 years ago. 35 times in 2016 versus in 2013. And so we've had a task force to address the issue. And what we do is that on the front end, we have all of our partners giving us alerts. And so the fire department, police department, hospitals, they let us know where it is that these overdoses are occurring. Then we send out teams in real time, including with our outreach workers who are here, to distribute information on naloxone, the antidote access, on treatment, and on other things to connect people to resources, to let them know how dangerous fentanyl is. Still, the more information we can get out to the most people as fast as we can, the better. And that's why we identified a need and a project for ways to get information out to people about clusters and spikes and overdoses when they occur. So the team that was selected for this partnership is Code in the Schools, and you'll hear more from David, about Bad Batch, the program that they have designed that will send text messages to alert people to spikes in overdose. And also how that program then allows the individual who sign up to get information about other resources like our needle exchange locations, Narcan availability, and so forth. So over the next year, we're going to be unveiling the rest of these 7 partnerships, and we're excited to continue to build on this model. Mm-hmm. As the mayor said, Baltimore has long been known as a hub for tech, for innovation, for partnerships, and Tech Health brings together these spheres, the public health sphere, as well as the tech and engineering spheres, in an unconventional alliance to tackle real problems facing our city. So I just want to end by quoting our mayor. Our mayor frequently tells our cabinet members and our community members that the success of our city hinges on collaboration, collaboration, collaboration.
They say it together in cabinet meetings. Collaboration, collaboration, collaboration.
And this is such a great example of a collaboration. And so I wish to thank the mayor and also thank David Gatewood, who is a member of our team in Code of the Schools, for working on Bad Batch.
So is David going to say a few words?
Yes. Okay. And we'll demonstrate also.
Go ahead, David. It's on you.
Hey, my name is David Gatewood. I graduated from Baltimore City College last year. Through YouthWorks, I was hired by Code in the Schools to teach other kids coding, and I was then asked to be a part of the Bad Batch team. Can we talk about the app?
Yes. Oh. Yeah. Show us. I was like, okay. We're glad you're here. But go ahead, tell us how it works.
Okay. Now we take through EMS. We get alerts from all over the city based off of certain fentanyl-based overdoses across the city, and depending on what region you're in, we send you that. Now, with that information, the user can not go to the dealer in that area, or not use the drugs altogether. But we take into account the fentanyl-based overdoses across the area, and depending on which region you're in, you get that message.
Okay, thank you. So you still working there?
Yes.
Good.
Yes.
Graduate? So good to know you're working. Let's make sure you got a job. Okay, great.
And we just passed out these cards, and so we encourage everyone to text and join us. It's actually very easy. I did this myself when I first learned about the program. And you text to join to this number, the 952 number that's in front of you. And you can choose your neighborhood, and then immediately on the back are all the different commands. So you can put join to sign up. You can put naloxone if you want to figure out where to get the medication from. Okay. You can do van and so forth. So we encourage everyone to try it.
Thank you. Any questions?
So you're going to gather up all this data about potential areas where there are drugs mixed with fentanyl. So what do you do then with that data? How do you get the bad batches out of the city?
We're not going, huh?
Yeah, let me answer this.
Okay, I'm sorry.
Let him take a stab at it. Let him try.
So the work that we do, again, is all in partnership with many of our partners, including with law enforcement, with health, and now also with Code in the Schools. And so what we do is we identify where it is that these overdoses are occurring, and we immediately, because we don't yet know what the overdoses are from. It takes time for testing to come back. We don't know that it's fentanyl, but we do suspect that when there is a spike, a couple weeks ago there was a spike of 20 overdoses in one area within a few hours. If we suspect if we see that there are so many overdoses in a shorter period of time, we suspect that it's fentanyl. So while investigations on the law enforcement side are occurring, and the police works with DEA, with other partners for that, our job as public health is to get out the word about the fact that there may be fentanyl in this area, and we alert people. So our outreach teams go out and they let people know that there may be fentanyl in the area. They then talk about the importance of learning Narcan and how to save a life. So we work in concert with law enforcement, and this is one additional tool so that it's one more way of getting out the message. Not everybody may be reached by street outreach, but maybe they can sign up for a text to know when this is in their area.
Good. So you all created this?
Yes. I had no experience in coding, and through a program that Coding Schools offered, I was asked to be a part of the project, the Bad Batch team. And yeah, we coded all the programs and all the texts, like all the commands that are on the back of the card.
Coding Schools working. Right? Okay. Any other questions? No questions? Okay. Thank you all.
Thank you, Madam Mayor.
All right. Not yet, you all. Something else. Where's Michelle? We have another program that we want to announce. I hope you all remember that tonight is the 6 p.m. is the consent decree hearings, the monitors. We're down to 4, 6 p.m., Morgan State University. Okay, please come. Michelle, how are you?
Very good. How are you?
Good. So Michelle is here to announce our youth snow program again. We popped this up last year, and it seems to work well. And so I wanted, so you all know Michelle, our transportation, look, I was up all night, transportation director of the Department of Transportation, and Frank Murphy is her senior director, and Nikaya Mack is the lead community liaison officer, Beverly Wolford, DOT Human Resources, Angela Delaney, office supervisor, and I guess that's it. So you want to explain the program?
Yeah,
Okay,
I will.
go right ahead.
Thank you. Good morning. Thank you, Madam Mayor. We're so excited about this program. And so once again, we'll be pairing youth and the elderly for snow removal. And it's August. Why are we talking about snow? Because we've got to start early. I also invited Connor Scott to join us. He runs our snow program. And we are buying new equipment and doing a lot for snow. But today we're focusing on the youth and the elderly. It's youth 14 to 21 years old. We pair them with the elderly. They're students who are in good standing, so 2.5 grade point average or above. They work for 2 to 3 hours, only during the hours of 7 a.m. to 7 p.m., and only when school is canceled or closed. Now, here's the good part. Regardless to how much snow there is, they make $500 for the season. So we've got some folks who have already signed up because that sounds really good to them.
Ready to go.
We
Pray
also
for snow.
Pray for. So we started registering youth on Monday, and registration continues until October 20th. The elderly and disabled also have to register. Registration for them begins September 5th and also runs through October 20th. So with that, I want to introduce our youth who are with us today. We have Gabrielle Canaday, we have Keon Mays, and we also have Taylor Shaw. So let's give them a hand.
Any questions about the snow program?
How do people, how students sign up for it? What is their phone number?
Yes, there's a website and a phone number. Can somebody? I have
The
it.
phone number that you're supposed to call is 311.
I have it here. Give me 1 second.
I call 311 is when you need somebody to move that system.
Jobs.trans, that's jobs.trans at baltimorecity.gov.
And she's right, you do call 311.
Or 311.
Email jobstraining@baltimorecity.gov, baltimorecity.gov. Right.
And how many you participated last year, and how many do you want this year?
So we need hundreds of youth. Hundreds signed up last year. We're hoping to exceed last year's number, so 400 and above.
That's what you're hoping to get?
Yes.
So it was about 400 last year.
It was a little under 400 last year.
Did they actually shovel, or they signed up?
Yeah, they shoveled.
400 kids shovel?
And then they show the picture of,
All that we need is shoveled, let's put it that way. So we match them up. So we have elderly who we match up and we connect them, and all who we needed shoveled, and all who signed up and showed up when they were called were paid, and it was a great program.
There's a verification process
with the camera.
Okay.
And do you know how many houses, how many apartments were?
Frank? Anybody know? Con? How much? Come on, speak up.
It was,
The numbers
it was
in the back.
approximately 1,872 seniors that signed up and were paired.
Okay. All right. Any more questions for DOT? All righty.
Thank you.
Y'all sure y'all don't have any questions? Okay. Okay, we have one other announcement, and that is that we have, are they here? The company that's relocated?
No, ma'am.
Oh, okay, just one.
You get questions.
Okay. Okay, you know, we do have a big company moving here. That is the U.S. Holdings LLC. It's the U.S. headquarters for New York, Baltimore. Connecticut and Baltimore were in the running, but the company selected Baltimore due to proposed loan, the accessibility to the airport, and the leasing prices for office space. The company will be required to have 25 jobs in place by 12/31/18 and maintain a minimum of 25 through 12/31/25. These are supposed to be great jobs. The company expects to host in Baltimore quarterly meetings with attendance for up to 50 people from Europe and United States. This would account for approximately 150 hotel room nights in the city per quarter, plus food and beverage spending. So that's a big plus for Baltimore. Yay. Welcome them. Media, welcome them. Thank you all. Okay. So, I'm open for questions.
Madam Mayor, why was it legal for the city to remove the monuments without going before the Board of Estimates and getting a contract?
No, did not have to do that. The city charter says that if the mayor, according to our city attorney, if the mayor wants to protect or feels she needs to protect the public and keep her community safe, she has the right to keep her community safe. And I felt that the best way to remove the monuments was to remove them overnight. I can tell you that I read the report. We set up a study when the 9 adults were killed in South Carolina in 2015, when this became a big issue around the country where people started removing monuments. We set up a study, not me, the previous administration in 2015 set up a study. The study was reported out in January of 2015. I think there was a written copy produced in August of 2015 that suggested that the monuments should be moved, at least 2 of them. It also said that a process should be taken where there would be focus on how they would be removed and the time period in which they should be, and that we should ask the Maryland Trust for one particular statue. But I can tell you that having read the report and seeing what's going on around the country and the sentiments that have been expressed, and if anybody has not heard Mayor Landrieu's speech in 2017 when he removed the 4 monuments in New Orleans, I suggest that you do so. And I thought that there's enough grandstanding, enough speeches being made, get it done. You know, I spoke with the council on Monday morning. I spoke with the president of the city council. I said, with the climate of this nation, that I think it's very important that we move quickly and quietly. I also submitted that to the entire body of the city council and said, we're going to be moving quickly, quietly, to get this done. And so that's what I did. 11:30, 11 o'clock last night, gathered, and we moved the statues. They're down.
Where are they and where are they going?
I don't know where they are yet. I mean, I was up till 5 o'clock this morning to make sure they got off of those podiums where they are. You know, I wanted them out of the city, and I would suspect that they're out of the city. I'll find out later on. I've been up all night, and so right now I'm just trying to stand on my feet.
Madam Mayor, if an organization like the Sons of Confederacy, for example, sues the city over the process of the removal, what will be the legal defense of the city?
I have no idea. I have no concern about what the Confederacy or what anybody wants to do in terms of lawsuits. What I know is I did what was right for my city. That was my intent, and it is done.
Madam Mayor, initially you said that, you need to assemble a work group, look into
No, I said no.
funding.
If you had read what I said is that we would assemble.
Yeah.
The group was assembled. It was already there.
Yeah.
And so
And do fundraising and get.
that's what the report said what I pointed out was that there are 7 things that the report said should be done. I didn't say that's what, Madam, I said that's what the report said would be done, and we reviewed those processes. We did most of those things. As I said to you all, I didn't start yesterday. My conversation with Mayor Landrieu began in June of this year. He removed his statues in May. In June, we met in Miami for the U.S. Conference of Mayors, of which I'm so grateful, because you get an opportunity to talk with other mayors from around the country who share, their concerns, their problems, and how they went about doing what they needed to do. And so I felt that enough speeches had been made about this. There was no need to do a big speech about why this should take place.
Were you concerned about the fact that there had been threats by some groups or vows to?
I think any city that has Confederate statues are concerned about violence occurring in their city. And I just think that Baltimore, right in the midst of getting the consent decree completed, this is not something that is needed, that I think that we should work together, figure out how we move our city forward. We've laid out our update on our violence reduction plan. We are about to complete our process as it relates to the consent decree, and we're working our neighborhoods and communities. You all know we had 8,800 young people who went to work this summer. We got the Squeegee Corps that we're working with, this program that we're working with. I have a lot of work to do. And like I tell folks, I don't need a lot of fanfare. I just like doing the work.
How much did it cost?
Was the timing of taking down the statues last night related at all to the threat that activists have made that they would take matters into their own hands tonight?
I didn't know it was tonight. I mean, I know what we were planning on doing. And I think if you would check with the President of the City Council, I sat down with him. I said what we were going to do. We're going to move quickly and quietly. And I did that.
When did you decide that last night or overnight would be the night?
No, I said as soon as I spoke with the President of the City Council, I said as soon as I get all of my ducks in order, I'm moving quickly and quietly.
And what message do you hope it sends? I mean, this is a debate that's gripping the whole country.
But it's also a debate that shouldn't be gripping this city. Because again, the council, the previous mayor did a study, completed, as you well know, you wrote the story January 25th, 2016. And I'm not a person who takes a lot of time to get things done. You should know that. I mean, the consent decree wasn't laying on my desk. As I said, other cities took 13 months, 14 months to do it. We did it in 60 days. I make quick decisions based on the facts and based on my capacity to get the work done.
How much did it cost?
I don't have a cost yet.
Yesterday affect the timing?
I didn't even hear the President's comments yesterday. I was too busy.
Can I just clarify, Madam Mayor? So you said you met with members of the City Council on
Monday,
and that's when you alerted them that you'd be moving with all possible.
Yes, I did.
But you did not indicate to them when exactly?
No, I did not. I said
When did you know when exactly this would happen?
as soon as I knew that they were easier to move.
Was that yesterday or was that Monday?
I think it was around Monday, Tuesday. I've been up since 5 o'clock yesterday morning, so.
So this came together Tuesday?
We had been working on this since June.
Right,
You know,
the final decision on timing?
No, the decision to remove them came together in June.
For the specific timing for this to have happened last night.
I was there at 11 o'clock last night, and we moved the statues.
Madam Mayor, how much did it cost to remove the statues?
I don't have a cost.
Can you clarify where the statues are going to end up?
Well, that we will give to the committee. You know, we know that there are, as I said before, there are Confederate cemeteries here in Maryland. There are Confederate cemeteries all across the nation. There are people who have inquired about them. A university has also, I think, inquired last year about them. I don't know that anybody followed through, and we'll look at that as well.
Madam Mayor, you mentioned that you wanted to talk this over with the Historic Trust. What makes that particular monument different than all the rest?
It had an easement issue.
I'm sorry?
It had an easement issue.
Did the Historic Trust release, I think according to the report from last year, the Historic Trust had to put out a signed document saying they're okay with the removal of the statue. Was that something they gave to you?
We sent them the request, but also the charter says if the mayor feels that she needs to protect her city, she has the right to do so.
So they haven't signed off on it yet?
I have no idea.
What's
It's
going
been
to go
sent.
in their place?
Well, I think what should go in their place is a plaque of sorts that tells what was there and why it was removed. You know, I don't think you can remove a statue, but it is a part of the history of this nation. And I don't know why they were put there. I wasn't here at that time, but I do know that they're offensive to many people in this nation.
You mentioned Mayor Lander as a inspiration in the way that you move forward.
Well, he's president of the U.S. Conference of Mayors currently, and I spent a couple hours with Mayor Landrieu talking about several things: crime reduction, the statues, and a number of things. You know, what was, his experience, what were his suggestions. I talked to other mayors around the country as well.
My question would be, what would you suggest other mayors who are looking at similar monuments in their cities? Is this a...
Do it quietly and quickly.
Any more questions?
Mayor, the one, like the Lee Jackson, for example, is a pretty large
Ooh, that was a big
statue.
one.
How difficult, what concerns were there about safely removing them just for the workers involved?
Yeah,
What were the logistical challenges?
We had, that one took the longest, took about, I think almost 2 hours at least to remove. The others were pretty easy. That one I think is about 14,000, I don't know whether that's tons or pounds or whatever, but it was quite huge.
Who actually did the removal? Were they contractors or city employees? What were the groups that actually carried out the physical removal this morning?
I asked contractors to help me.
Was it White and Turner?
They were one of them, yeah.
What was the other one?
I don't know that anybody else was there. I asked for help, and people came. I think when you do good things, people will help you out. This was a situation that I thought was long overdue in the city, as I said, as were many other things that I've come in contact with as the mayor of this city. And as I said, I don't like things to linger for long periods of time. That was my discussion with the president on Monday, and so, we moved forward.
Will we see the cost eventually go to the Board of Estimates?
I'm sure you will.
Which department would it come through? Will it be the DOT?
I don't know. I'll find out. I'll let you know when we find out. Hopefully it's goodwill. Thank you.